So we're going into this next step of our analyzing cues here. So as we analyze these cues, we're going to take them one by one. So this is where we're going to look at that middle column, and it's a single best multiple choice. That's how you're going to approach it. And I want you to ignore the actions and the parameters to monitor for now. So we are concerned here. I'm concerned that we have this 34-week pregnant client with this mild lower abdominal cramping and some bright pink vaginal spotting. Now, these are signs of preterm labor. So as somebody's in labor, we get these mild abdominal cramps to start. Of course, they're going to get stronger. And we get this bright pink spotting, which happens with effacement as that cervix dilates and effaces. But let's look at all of our choices to determine if it is something to be concerned about or not. So we see placenta previa, which somebody had mentioned, and that was a great thought. So what do we know about placenta previa? What is the characteristic of a bleeding in placenta previa? Remember, placenta previa is when that placenta implants low over that uterine, low in the uterus over that cervical opening. So typically the bleeding in placenta previa is going to be painless, right? But this client is having mild abdominal cramping, which means that she is not having painless bleeding, right? So that right there is going to tell us that it's probably not a placenta previa because of that, because she's having that early little mild pain that we're experiencing. So next we have pulmonary embolism, and we need to decide if that is a problem or not for this client. So what is a pulmonary embolism? We get this clot, right, that's obstructing our blood flow to the pulmonary arteries. So does anybody think that it's a PE? I saw somebody saying that the vitals are good. And so that's correct. What would we expect with a pulmonary embolism? The client would be having trouble breathing, right? Her pulse oximetry definitely would not be looking so fantastic at 97%, right? And an elevated respiratory rate is kind of expected in pregnancy. So looking at this image here, you can see here on this side, this is a normal person that's not pregnant. And in this case, what's normal is we take this inhale and our diaphragm is going to contract down and allow those lungs to expand. But in pregnancy, that uterus is in the way and it doesn't allow full expansion. So a client might have some dyspnea and exertion. Yeah, persistent dyspnea. I see that. Perfect. We don't have that, right? We just have occasional mild shortness of breath happening for this client. So a PE is not likely. Okay, so our last option here is an intrauterine fetal demise, or an IUFD. So an IUFD occurs when we have a pregnancy loss after 20 weeks gestation. So what are our thoughts on this? Do any of our findings indicate an IUFD? This client has not felt the baby move very much today, right? But we could have maybe a deep fetal sleep state. So I don't think that an IUFD is most likely. So what are we thinking here? Now we are making our final decision. What do we think this answer is? I see everyone or a bunch of people have been saying preterm labor, right? Does that make sense, hopefully, to everybody now that we've broken down each step? So preterm labor is most likely what this client is experiencing. So all of these options, as you see, were potential, right? That previa, we had the bleeding, but we had some pain. All of them had something that made them seem likely, but also not as likely as our preterm labor. So given the information we know, we're going to go with preterm labor.